Welcome to SNP Vasectomy Clinics. We're New Zealand's largest vasectomy provider, doing thousands of vasectomies every year from our clinics right the way across New Zealand. In this video, I'm going to talk about the things you really should know before committing to having a vasectomy. The first one, the most important one, is vasectomy should be thought of as a permanent procedure. That is, once you've had it done, it might not be able to be undone. Yes, there are reversal operations, and they're pretty good, although they are pretty expensive, but they don't always work. So you must consider that once you've had your vasectomy, you could be one of those guys for whom reversal is not possible. Now, at SNP, we don't make decisions for you based on your age or the number of children you do or you don't have. But of course, if you are younger, or if you don't have children, that decision to permanently end your fertility is a really big one. So make sure that you're really sure of your decision before going ahead. Some guys like a little bit of an insurance policy, and it is possible to freeze some semen before you've had your vasectomy, keeping it at a fertility clinic on ice, just in case in the future you do change your mind. We don't do that ourselves, but we can always help you organise that should you want to. The second thing I want you to think about is the risk of vasectomy not working. Now, vasectomy is an extremely effective form of contraception, but sometimes it does fail. And if it fails, it's usually because the tubes that have been blocked manage to grow themselves back together again. This is much more likely to occur during the early stages after you've had the procedure whilst you're healing up, but theoretically can occur at any time in your life from a few months to years after your vasectomy. For practical purposes, we call these either early or late failure of vasectomy. Now, as we'll talk about later in the video, we need you to be sure and to do a test for clearance after your vasectomy to know that it's worked. And there is a time delay between your vasectomy and doing that test. Now, early failure, which is more common, is going to occur during that period of time when you're still using contraception or other forms of contraception, and you're not trusting your vasectomy. So should an early failure happen, we will find out about it before you trust it, and therefore the risk of unplanned pregnancy isn't there. Sure, it's pretty annoying, and you will need to have another vasectomy to overcome it. We won't charge you for that, obviously. The risk of that happening is about 1 in every 300 vasectomies we do, which means 299 guys out of every 300 don't have that worry. Late failure is exactly that. It occurs late. It occurs after you've been given clearance and we've told you that your vasectomy has worked, because it has, and that sometime after that the tubes manage to heal themselves back together and your fertility returns. And of course the risk of that one is you're trusting your vasectomy and an unplanned pregnancy can occur. Now, the risk of that happening is about 1 in 2,000 guys that we do a vasectomy on. Now, sounds pretty scary, and nothing's perfect. What I want to reassure you though is vasectomy is way more effective than any other form of contraception that you've either used or could use. If someone has their tubes tied, if a woman has her tubes tied, her risk of getting pregnant again after that is 1 in 200, so 10 times worse than a vasectomy. In terms of the reversible forms of contraception, the best ones we have are implants and IUDs, and then their risk of failing is about 1 in every 100. And things other than that, like pills, worse still, and condoms, worse than that. So vasectomy is the best of everything, but it is not absolutely 100%. We should also talk about the risks of surgery, risks of having the vasectomy surgery. Now, every vasectomy runs a small risk of complications. Infection is not that common, but can occur. Probably 1 in every 200 guys that has a vasectomy could develop an infection and require antibiotic treatment to get that to settle down. Similarly, about 1 in every 100 guys that has a vasectomy can have bruising and bleeding afterwards, and can have quite dramatic bruising of the scrotum and of the penis itself. Now, it does settle down, it disappears within a few weeks, but it can look fairly dramatic at the time that it occurs. One stage on from the bleeding and bruising is the development of a hematoma, and this is where the procedure may have gone absolutely fine and you've left with no problem, but at some stage, a few hours or days after your procedure, a blood vessel inside the scrotum opens up and it bleeds and causes the collection of a blood clot. Now that clot itself pushes back on that vessel, stopping the bleeding, so it does stop itself essentially. But you are left with what feels like a third testicle, and it's quite uncomfortable, and it will take a number of weeks for that to settle down. So annoying, but not serious in terms of long term. The final complication is rare and probably more long term of an issue, and this is something called chronic testicular pain syndrome. Now what that means is a continual aching feeling in the testicles. Now this is separate from discomfort that may occur because of the surgery that lasts a few days and settles down. This is something that can come on months or years after a vasectomy when things have been successful and you haven't even thought about your vasectomy again. And to be clear, men can develop an aching sensation in their testicles without ever having had a vasectomy. This is a known syndrome that can occur without vasectomy. But having a vasectomy makes it a bit more likely. Probably 1 in every 200 vasectomies, this can occur because of the vasectomy. Now, it is treatable, and we'd encourage you to get back in touch with us if you do develop any long-term aching or soreness in the testicles, and we can go through the treatment with you. So it's an annoyance, but it is something that we can get under control for you. Finally, now I want to talk about the things that actually aren't a problem with a vasectomy, but if you've gone Googling, you may have come across them. Number one, categorically, vasectomy does not affect your sex life in any negative way. It won't drop your sex drive, it won't affect your erections, it won't make your climax or orgasm feel different or look different. Your testosterone, that's a very important male hormone involved partially in your sexual function, is produced by your testicles, but the production of that is not affected by your vasectomy. And in fact, for some guys, their sex life gets better because they're no longer worried about an unplanned pregnancy. Another thing that you may have come across if Googling is the link of vasectomy to other health conditions. I've seen things like prostate cancer or Alzheimer's. Now, it is not linked to any of these, or it certainly isn't a cause of any of these. The way that this has come to sort of pass is essentially what we know is that a guy who chooses to have a vasectomy is someone who on average is probably someone who looks after themselves, looks after their health better than the man that doesn't think about having a vasectomy. And men who have vasectomies generally are more wealthy, more educated than men that don't. And looking after yourself, being more wealthy, being more educated is actually linked to you living longer. And which is a good thing, but of course living longer means you are more prone to diseases of old age, such as prostate cancer or Alzheimer's. So in a way, if you use the logic that has put these things together, I could claim to you that vasectomies will make you live longer. They won't. But of course, as the man that chooses a vasectomy, you're likely to be the sort of man that will live longer, and therefore, whilst vasectomy doesn't cause Alzheimer's, the fact that you might live longer might give you more chance of getting it. So those are the things I need you to know before you decide to continue with your vasectomy. And if they're all good with you, then we're good to go.